So this field was actually suggested to me by my dad back in 1988 when IR was just starting to grow. And my father was a hospital administrator and a physician, and we lived in a foreign country at the time, and he said interventional radiology is going to be the future of medicine from a procedural aspect. He knew that I enjoyed tinkering with a lot of things. I liked to build models, play with my hands, do stuff. I enjoyed the idea of being a doctor, but what I like about interventional radiology is that I'm not only the patient's doctor, but I'm also a doctor to my doctor colleagues, because we relate and help our colleagues troubleshoot and problem solve, and are consultants to them as well. So one of the procedures that we started doing at Mather Hospital is something called Y90 or radioembolization, which is treating liver tumors with radioactive beads. My first patient that we did here 6 years ago is a survivor, and we were able to get her to participate in a fashion show where her grandchildren were able to walk her down the catwalk, and I went to that event, and it was really personally gratifying to know that I helped this patient get to this point and be able to do that, which was a very valuable experience to her and her family. So working at Mather for 15 years, one of the things that I love the most are the people and the patients. I have great support from the administration, which helps me to provide the services that I do, but the people that I work with, my team members, the patient population, and being able to work with my physician colleagues in a very small knit setting, which promotes camaraderie and allows us to be more cordial and intimate in terms of our patient care. So one of the things that I'm absolutely passionate about is my patient experience. I really want to make sure that my patients have a comfortable experience, that they are well informed, that we take the time to talk to them and address their concerns. And quite frankly, at the end of every procedure, I want to make sure that they went through a good experience, regardless of how short it was, how long it was, how difficult it was, or how simple it was. Anybody who knows me knows that I'm a Batman freak. I took that character on because of its dual personality, and I believe that an ordinary human being can be extraordinary just by their own expertise and knowledge and training, which is how I look at myself when I practice.